I still have a lot of friends at AIL, plastic surgeons who I worked with actually. Right now I'm not working with them though. I'm working with the Stanford people. But, alright, we just take this off. Did we take the scan? Not yet, right? Oh, this is nice and easy for him. That's incredible. Okay, that's good. So yours was a much more simpler, straight forward. Push. Open your mouth. Open. Cool. Yeah, you can show him the improvement. You can look this way. So in your case, you're going to appreciate the improvement more from the side view. I want you to have a look at that. Look at that, the side view. Look at your chin. Look at your mandible angle. Isn't it incredible? I mean, this has become like this now. Wow. Right. Now, the same can't be said in the front view. In your case. Now let's move to the front view. Look at that. People won't even know anything much has happened in the front view. Because of the way of our chin augmentation, because of the way we've moved the bony part. Because see, your face in the front was already pretty proportional. We don't want to do much changes here and disrupt your already good proportions. Hence, the improvement is not as pronounced in the front view as compared to your frontal view, right? Now we're going to go show the other side also. You'll find similar improvement. This other side of the picture is not there? Yeah, look there. You can see now. Even look at this angle. You're a young guy, but now you're going to look that way. Straight angle. This distance, you see, it's a straight line. We haven't done anything here, mind you. But it's just that the muscles have all come forward along with the chin and along with the angulation of that movement on that anterior part of the chin. You know, this genioplasty is not just one osteotomy that we do. I do multiple variations to it. And this is a very classical example where the front view doesn't change a lot, but the side view is like, wow, huge improvements. I mean, you will be amazed to see the improvement. See this view especially. I mean, you can turn this side and this side, other side, please. Look at that. And we haven't done anything for you there as well. It's just because the muscles from here are pulled forward, and you get a very, very nice, beautifully defined jawline. Look at that. And this is with the swelling. So it's going to get better. 5 days later, with the swelling, the definition is so remarkably improved. So it's going to get much better and stay that way.
So, doctor, one question. It's regarding, is this area, is it swollen or is it just what we're seeing is already evident there?
You already had loose tissue there, which we called as submental fat. Maybe the muscles are bunched up. Now that's all gone because we've stretched it forward by means of this osteotomy. So that's not going to come back. If you put on 10 kgs, maybe you still will find a little bit proportional increase in the... that might happen. But otherwise it's going to stay there.
Understood.
All right? And so you go back when now? Tomorrow?
This evening.
Yeah. I remember we did surgery in a hurry, right? We got him on board in the last minute and... Yeah. So that's also an exaggerated feature, the buccal pad fat. So this is something I think I have not stressed enough. Buccal pad fat, yes, it reduces the volume of the cheek, but the most important job that it does is it augments the jawline surprisingly. Well, not surprisingly in all cases, because the buccal pad fat is not here, the buccal pad fat is here. So it's actually right there that goes in, so it exaggerates this part.
Doctor, I see a kind of a dent here. I mean, it's not dent, probably.
Show me. When you feel it?
I don't feel it. I
then
just see it. So
there's a small depression there, you think?
And I don't see it evident here.
We'll take a scan and check. It shouldn't be there in the long run. It's also see because we haven't placed the plaster symmetrically, so sometimes these small things can happen. It looks good to me. I think it looks fine.
It's just that this line is going a bit in this particular direction. This is coming a bit in a different angle.
But that should have been there even before. It should have been there before. Look at that. It's different. It was the same before.
No. I mean, not just over the line. I'm asking if this line is causing this particular dent.
No. So the lines are formed by the interpositioning of the muscles. So we have 8 muscles that are joining here and that forms a modulus. Remember, we have done nothing to that. So if you see that groove is different, already different, pre-existingly different. It will stay like that. We are not made symmetrical with that. That's a dynamic aspect of your facial musculature.
But this depression, it'll
I
come
don't
this
think
way
there
or
should
it'll
be any
go-
depression. It just looks, I don't even see one now, but yeah, if you look closely, maybe a millimeter or 2 here, but it's going to be fine. I don't think there's any issues there. We'll just take a scan too, just to be sure that the plan has been executed, and then the plates and screws, especially the screws, are all in the right place. So we'll do that before you leave. Do it now. How is your pain in a scale of 0 to 10?
So I didn't take any painkillers after the night of my surgery.
What?
Yeah.
Hey, Priya, what is he saying? He was not given painkillers after the night of surgery?
I voluntarily asked
Not to take. But why?
There was no pain at all.
Really?
Yeah.
You're kidding me. How can you not have pain? No pain after one day?
No, nothing. Like the biggest pain I had was putting the IV.
But that's the antibiotics.
No, it's because of the IV and yeah, only that. But apart from that,
But there was no pain here.
nothing.
And she refused even pain medications.
Painkiller was given.
Oh, you are special. It doesn't happen like that.
But,
Because we've cut the jaw and brought it forwards and all that. How can you not have pain?
but yeah, I mean, I just not
Oh,
just me. Even the people around me are like, we didn't have any pain. The biggest pain we believe is from
Removing.
bandage, yeah.
Even the same happened with that gentleman. But in your case, even that didn't happen much. Yeah. That, yes, unfortunately. But you didn't have pain even after the second day. That's incredible. I keep, even after so many years of doing this, for having done for several thousand patients, baffles me suddenly, like this. And then on the other hand, there is a patient, this lady, whom we did some surgeries like 10 days ago, and today morning she was complaining of pain. And there's no reason. Very rarely both extremes can happen, I mean, no pain is as rare as someone complaining of pain after 5 or 6 days after pain medications. So anyway, it's nice to hear that you didn't have pain, because see, as long as a procedure is pain free, or most worry human beings have is about pain, obviously, and most of our patients also always wonder, डॉक्टर दर्द कितना होता है, कितना दर्द होता है, मेन क्वेश्चन, कितनी बार बोलो फिर दर्द कितना होता है.
But after interacting with people around me in the last couple of days, I think the pain levels is the estimated is very much on the lower side. I mean, they are expected to be a bit
More.
painful, but in reality,
It's lesser than that,
it's like non-existent. Maybe a couple of days of uncomfort.
but
So
not
pain
so
is
much
wrong
pain.
word.
That's really a very, very good input from your end, because some of the patients also fail to express this clearly. We ask them, they say, हाँ sir, दर्द अभी नहीं है, कल था, there's something like that. But the earlier patient also said that there was very minimal pain. I'm really glad to hear that we've been able to get this kind of a change without much pain, or without any pain.
Zero pain. Yeah.
Zero pain is like, I would feel I'm in the seventh heavens, I mean, anyways, I'm glad to hear that though. So you take care. Now remember, just because the first few days was pain free and eventless and smooth, and the entire healing is not over. You just embarked on that journey, and the bony healing completes after 4 weeks. So you have to be careful. This is one other point, when everything goes very easy for patients, when everything is so quick and smooth, then everything becomes relaxed, and suddenly you should not land up into a scenario where you might need some, so take good care, right? It's nice that everything has gone better than planned, but make sure you continue the same care for 3 more weeks. So after a month, then it's like nothing can happen after that. Even after, usually the soft tissue heals in 7 to 10 days. So after 10 days, you should be fine. Like you can get back to pretty much normal diet. But I recommend all my patients to be careful. Like, don't keep kids on the lap. Remember that you had a major procedure, whatever it is, for 4 weeks. Because after 4 weeks, once the bone heals, even if you get a slight bump, it's good.
Yeah.
Otherwise, a slight, quick, sharp knock can sometimes just move a screw by a millimeter or two and can cause a slight issue or a bleed or something. So take care on that, and take our follow-up number. If there's any issue, even when you go back to the US, you let us know,
Absolutely.
so that the time distance difference otherwise is a difficult thing for us to handle. All right?
And regarding the screws, I can just let be.
Yeah, we'll show you the scans. Nothing will happen to them.
I mean, they don't get. I
Nothing
don't know
happens
they're
with them.
inert, but,
Yeah, it's titanium we've used, and so it's really the best implant that you can get. Having said all of this, there are a small percentage of patients who like to get that removed, mostly physicians and doctors who think there's no need of it being there. I don't recommend it because we've seen it never causes a problem ever. But if you are paranoid, or if you think you wouldn't want a foreign metal sitting there, anytime after 6 months, it's a day procedure. So you come in the morning, we take it off, and the next day you're good to go same day. So
and the healing time is the same.
no, much quicker. They were not going to cut the bone.
Okay, yeah.
We only
stitch it.
just remove the thing and stitch it. So I don't recommend that. But if you are thinking a lot about these screws that's inside, what it might do to you after 50 years, I don't know.
I understand.
So in that case, we can take it off. Some patients, I don't recommend doing that when they have multiple, that patient who's sitting in the other chair next to you. I think we've put some 8 plates and 34 screws. So we don't want to remove that. That's a crazy big procedure all by itself. But for you, it's just 2 plates and 4 screws. So it's easy.
But again, in the short term, I don't think it should be any.
I don't think you should remove or think about it. Just forget about it. In fact, patients feel so comfortable, they don't even know there's a plate and screw later on.
Of course, I mean, that's the same.
So that you don't worry. It's not going to be any thing of concern at all. Chalo then. Take care.
Thank you, doctor.
Welcome.